Do you ever wake up with a tight jaw or a tension headache? Have you noticed the sensation of a burning tongue or your mouth feeling dry no matter how much water you drink? What if it's hormones talking through your mouth? Today we're unpacking the surprising symptoms of menopause that impact your mouth and the structure of your face and what you can do about it. Welcome back to All About You. I'm Dr. Shauna Watts, GP and women's health advocate. Every week I share evidence-based conversations that help you navigate the changes of midlife with clarity and confidence. My guest today is Dr. Martina Lavery, an experienced Sydney-based dentist known for her integrative approach to oral and whole body health. Martina is passionate about helping women understand how the mouth affects the rest of the body, especially during menopause. If you've ever wondered what impact a dry mouth might have on your health or what losing teeth may do to the shape of your face, today's episode will connect the dots. By the end of this episode, you'll understand why hormonal shifts in menopause can trigger mouth-related symptoms that may be surprising, the real health impacts of jaw tension and grinding your teeth, and what structural or aesthetic changes might occur to your face as you age or as a result of dental issues like losing teeth. Remember, this is general information only, not personal medical advice. Always consult your own healthcare provider for guidance. Martina, welcome to the podcast.
Thank you for having me.
I'm so delighted to finally get you here. I think we've been chatting about this for about a year, and I think we'll just get it out there. Yes, you are in fact from Northern Ireland as well, and we were at Queen's University in Belfast in the same year. And you were in the dental school and I was in the medical school. So I want to jump in and ask you a question, which is a bit more of a general dentistry question. Why the heck are so many people scared of the dentist?
I think there's just so much vulnerability. You're trusting someone to take charge of your breathing while, you're having treatment done. It can feel really overwhelming. It's painful. It's invasive. It's uncomfortable. And I guess, there's also a cost factor as well. And I think like everything, past experience dictates the future and the present experience.
Is it because years ago the way pain was managed in the dental chair was really bad?
I think so. Most people of a generation before us will have had negative dental experiences, whether that's felt that they weren't listened to, whether they didn't have control over decision making. Pain is a huge thing. And pain is also a big instigator of treatment. So someone will come to the dentist when they're in pain. So there's that association as well. So I like the challenge of taking on a patient that is nervous. Most patients don't like it, but I feel like whenever you have a calm environment, you try to take the patient on board with their treatment and make them the master of the treatment planning along with you. I feel like, it helps them. And I do like treating patients who are nervous and empowering them.
One of the things that that we're both very passionate about is menopause. So I want to have a little bit of a shift and I want to jump into understanding what is going on in the mouth at the time of menopause, because we're beginning to get everyone to understand that these hormonal changes are literally from the tips of their head to the tips of their toes. But obviously the mouth is included in that. So, and I know that's really a bit of a passion for you. So what is going on with the gums, saliva, oral tissues that is changing in perimenopause and menopause?
I think there is so many changes that are happening at this stage of a woman's life. And I think obviously estrogen is very protective of inflammation. And so estrogen, we just used to think, as you said, that estrogen was just there for reproductive health. And, you go through menopause, you stop having a period and the body continues as normal. But we now know that that is not the case. So estrogen is very protective from an anti-inflammatory point of view in the soft tissues of the mouth. So I like to break up the mouth into hard and soft tissues. So soft tissues like the gums, the cheeks, the tongue. And then the hard tissues is the bone and the teeth. And then also, what we see is the effect during menopause on the extraoral tissues, which is the TMJ and the joint. So, what I see on a daily basis is an increased presentation of women saying that their mouth just feels different. It feels drier. When your mouth is drier, you're a little bit more prone to like friction, ulcers, irritation in the mouth. And then also, it can make the teeth more sensitive because you're not having that beautifully protective superfluid of saliva bathing the teeth. And then I think it goes back to the psychological impact of menopause and the protective impact of estrogen in the brain, because anxiety, and you would see this as a doctor, I'm imagining in your clinical practice every day, that there is a huge increase in the physiological signs of anxiety. So patients, not sleeping well, having interrupted sleep, grinding their teeth because of stress, clenching the jaw. So I think it all links back to what's actually going on in every system of the body.
And so, if we think about saliva, why are we complaining of having a drier mouth at this time of life? Like, what do we know what the mechanism is and what is changing related to hormones that suddenly are we just producing less saliva? Or why are people saying, my mouth feels so dry, I keep drinking water and I feel like I've got a really dry mouth?
Yeah. So I think that can be attributed to a few things. Pharmacological reasons. Sometimes patients are, sleeping poorly, feeling depressed, anxious. So they're taking medications that will actually induce that xerostomach effect, so that effect of dry mouth. And also, we are seeing in the literature that it's probably more the neural tissues that are being affected because of that anti-inflammatory action of estrogen that's diminishing. So it's actually a neural signaling that is making the mouth feel dry as well.
Right, okay. And so, why is a dry mouth an issue? Like, does it matter?
Yeah. Look, I think the reason for having the dry mouth is important. Is that patient competent with rested lips whenever they're resting? So are your lips closed together? Is that your natural rest position of your face with your lips closed? That means that you are driving all of your breathing nasally. So that is going to make your breathing much better in terms of your inflammation, the amount of oxide that you have. And so really that's what we want. And we even see that in kids. We want them to have closed lips. We want to be breathing through the nose because that's going to actually improve the seal in the oral cavity. So if we can have the lips closed, the mouth is not dehydrating. And that's another big thing for menopausal women. This sleep disordered breathing, where there's opening of the mouth, the laxity of the tissues, the muscle control is much less. So there is more opening of the mouth. And so sometimes patients will say, I just feel so dry when I wake up in the morning. And it's probably because they've had interrupted poor quality sleep and the mouth is drier.
Isn't it interesting how the focus has shifted to so much more about how we breathe and nasal I don't really remember us spending a lot of time on that, to be honest, in medical school, and I think it's gone full circle in that in ways it's such a basic thing, and yet we haven't really thought about it or talked to patients about it for such a long time. And even just as you were talking there, thinking about, yeah, of course we need to be really having a resting face with a closed mouth. And it doesn't even strike me to think about that a lot of the time. If someone feels like they've got a dry mouth, is there value in using one of these sort of artificial salivary products that you can buy at the pharmacy? And what would be the benefit of doing that? Apart from your mouth feeling more comfortable, is saliva important in terms of cavities and dental hygiene?
So I think first and foremost, it's good if anyone is suffering that out there and they're listening to go and get it checked because the majority of times it is not related to something sinister. But, saliva is made by the salivary glands. So it's really important to have that checked and make sure that they're functioning well. And saliva flow and saliva quality can be measured to actually get a very accurate diagnosis why an exclusion. I think excluding things of the reason why the dry mouth is there in the first place is really important. But, if we don't have pathology, if those glands are normal and it's more related to menopausal changes, pharmacology changes, then I think supplementing with good oral hygiene products specifically for dry mouth is good. So there's a toothpaste, there's rinses, and there can even be a spray. And a lot of people are drinking a lot, but the water is not actually helping the mouth. Of course, it's good for the rest of the body and it makes all of the systems work better when the body's hydrated. But I would say probably the mouth and the skin are probably one of the last places getting the water. And it can be quite debilitating for some people. They really feel like their speech is even impacted. But getting back to what you were saying about the cavities, so we need saliva as a buffer. We need it to buffer all of the acids in the food that we eat. And I think people who don't have good quality or quantity of saliva, they are very predisposed to cavities, particularly along the gum, along the root of the tooth.
Okay, and then that leads you to the old dreaded root canal and all that kind of stuff.
Sensitivity can be one of the first presentations. People come and they say, oh, it's been really sore over Christmas. I've been eating lots of chocolate, drinking lots of wine. My teeth are really sensitive. And you have a look and you think, a little bit dry. Looks like even you might have been brushing a bit too hard and the root is exposed. But the mouth being dry does not let you get away with what you used to get away with.
Yeah.
Because the saliva is very protective. I think it's like one of the superfluids of the body.
And I did read somewhere that the pH of the mouth seems to be shifting a bit in this time of life. And obviously, people have heard of lots of chat about gut microbiome. And now we're talking about skin microbiome and we're talking about vaginal microbiome. Is something going on with the mouth microbiome, with the bugs that live in our mouth?
Yeah, I think so. So there becomes a dominance of one particular species when you have increase in inflammation. And then we have so many links now with inflammation in the mouth. So we really want to have as broad a species of bacteria in our mouth as we can. And I find it really fascinating that the bacteria on your tongue are a family and the bacteria on your cheeks are a family and they're different.
And so how do you influence that to make them healthier?
Biggest misconception, and I say to patients on the daily, is mouthwash. So some patients will just use mouthwash as a means of cleaning the teeth, but it actually does disrupt the species of bacteria. And then actually if one species overgrows, then you can have what's called a dysbiosis, which is an imbalance in the amount of bacteria in the mouth. And it may not be favorable. And you can get like a coating on your tongue. It can lead to candida infections, like a fungal infection, like athlete's feet. So I think the mouth should really be treated like every other part of the body. And the skin is very similar to, like when you're going through atrophy in the vagina, that skin membrane, you can have that kind of thing going on in the mouth as well, like lichen planus, lupus, these autoimmune issues that can present.
So let's talk about another symptom that comes up a lot in perimenopause, which is burning tongue. Can you explain to anyone listening what do we mean by burning tongue, or what does patients mean when they're talking about that? And do we know what on earth's causing that?
It does need to be investigated, usually by a specialist dentist, like oral medicine. It can be really quite debilitating, and it's really related to the neural signaling. That's what we believe. The tissues are not actually changing. It's the neural pathways that are being perceived that are differently. And also because of that inflammation, the protective influence of estrogen is not there. There's so many beta estrogen receptors in the mouth. It's particularly on the tongue and the cheeks. And it just seems to be such a really, poorly understood condition that affects a lot of women.
Do you think it responds to taking, menopausal hormone therapy or HRT? Like, do you see improvements?
My antidotal experience would be yes. I think so. And even some supplementation, vitamin B, zinc, and I guess doing all the right things, stress, alcohol, spicy things, getting enough sleep, all of those things. But they're all at a peak because, many of these women are sandwiched between kids growing up, teenagers, elderly parents, they're probably at a pinnacle in their careers. So it's not easy to say to someone, oh, relax, don't be stressed. Yeah, like it'd be nice to take that advice yourself.
So another big issue that I see in clinic a lot is headaches. And obviously you can have headaches for, a multitude of reasons, but I'd love to have a little bit of a chat about from the dentist's perspective, the things that could maybe be contributing here at this time in life.
Predominantly, we see a patient with a particular phenotype that is just really generally a genetic disposition to these things. So the phenotype patient that is likely to have a headache is usually a patient who will be more type A, more stressed, has an element of tooth grinding or tooth clenching, which is collectively just known as bruxism. And that can then lead to pressure here on the masseter going into the temples. And obviously, it depends where the headache is presenting. And yeah, I do think it is quite common.
This episode is brought to you by my 16-week Rediscover You program, designed specifically for women navigating the challenges of perimenopause and menopause. If you're dealing with disrupted sleep, mood changes, or unexplained weight gain, this evidence-based program combines medical guidance, practical tools, and a supportive community to help you take control of your health. Women have reported significant improvements in symptom management of sleep quality and overall well-being. As an All About You listener, when you mention the podcast, you'll gain priority access for our next intake. Click the link in the show notes to learn more and join. I'd love to help you rediscover the vibrant, confident version of yourself. I see a lot of women in this. I mean, I see, to be honest, even a lot of younger women complaining of jaw clenching, really sore. They'll come in and they'll say, "Oh, I just catch myself. I'm clenching all the time when I'm working on the computer, or I wake up in the morning and I've got terrible clenching." And obviously, I see a lot more women than I do men, but it do, do we know, is this a problem that's equally across the sexes, or is this an issue that we're seeing more in women, this clenching causing issues?
I think at this stage of life, in perimenopause, menopause, it does seem to be more prevalent in women. But I guess the robust studies to really quantify that, it's hard. But in my clinic, I definitely do see, or the treatment presentation and the treatment sought by patients for that kind of problem is more in my females over 50, even over 40 now.
That group of women present to me a lot with, they're often referred to me from their dentist, to have some treatment with toxin, and, they're doing a mouth guard, but, it definitely can take a long time to settle. And this actually can really take a toll. I think I've really learned a lot that it's not just a bit of tooth grinding. Like, people can end up nearly quite depressed by the pain. It becomes nearly a massive focus of their whole life because I don't know, their jaw's hurting, then they get a headache, and then their neck's hurting. And I've had patients who've literally been bouncing from the dentist to the physio to the chiro. They've even seen neurologists, they've been to the max fax surgeons, and we're bouncing round in circles and, having all these scans, and, we just end up coming back to, yeah, you're clenching.
And that's a really hard conversation to have with people who have this problem because there is no cure. It is management of symptoms. It really, you will always have it. You will have periods of remission. You will have times when it is exacerbated and spikes. And it is just being able to manage it. And I think when people are acute and they come to you to seek help, they're really, really proactive about treatment. They're keen to do treatment. They're keen to do exercises. They're keen to do stretching. They're keen to have scans and, all of that done, and even have a splint made. But then when it resolves, like human nature, we want to be like, I don't want to do those exercises. I'm fine. And it's about being mindful. And I think the biggest thing, if I could really just get the listeners to take one thing away, is to just like, I guess in the day, like just carve out 2 minutes, mid-morning, afternoon, and before you go to sleep, to actually think about where your tongue is. So where's your tongue?
It's sitting on the roof of my mouth.
Awesome. Well, you're a great patient. But most people who are clenching are like this, and the tongue is tense and flattened. So if we actually think about where our tongue is and we rest it on the roof of our mouth and get the tip just behind the two front teeth, we're actually pulling the jaw a little bit down and forward. And this joint is like a hinge joint. So it should open like this, da-da.
Right. So this is your
The
TM joint.
TMJ.
Yeah.
Okay, so the TMJ is the joint that holds pretty much your head to your jaw here. Like it's the connector, allows you to speak, eat. And really, our teeth should not be together unless we're chewing or swallowing. So if you think about like the drive here today, I was like, ooh. So most of the time we are, and this is a phenotype that you're predisposed to be like this. If you're very chill, you're unlikely to present like this. So we're biting like this. We're engaging the muscle, the masseter, temples, making that tight. And then the way that the disc is sitting in that joint is changing. And that's what leads to the bony and the ligament changes. If a patient is just having facial pain because it's muscular, so like if it's myofascial pain, that's actually quite easy to get on top of because we can do lots of things. We can do physio, we can do stretching, we can make a splint to change the stretch of that muscle spindle. But it's when that altered tension and hypertrophy, like that bulking of that muscle comes, that the disc and the way it sits in that joint moves and it gets displaced. And then it can't move forward and back. And then we get the locking, we get the clicking, and we also get that chronic pain. So instead of it being facial pain, it's like arthritic pain, it's arthralgia. So that's where we don't want those patients to get to. And there's so many really good preventative things. Tox works very, very well in those patients that are very acute. But also, I think the diagnosis needs to be made very, very early on with clinical assessment and imaging so that we are not just toxing a muscle that is actually the only thing holding a fragile jaw together. Because that can just completely exacerbate the symptoms.
Well, it's interesting whenever you think about like how we're now all talking about frozen shoulders, and the relationship with perimenopause and loss of estrogen of that joint capsule. It kind of does then make sense that probably something very similar could be happening, albeit in a tiny little joint, but such a joint that just never gets a rest.
Never stops. And particularly if then you are giving a workout. So it's like you've got a six-pack. You go into the gym, you sleep for 7, 8 hours a night, you're clenching your teeth together. They're only really meant to be together for probably 10 minutes in a 24-hour cycle. Because when we swallow, when we chew, depending obviously on what you're eating, but we really should be trying to get the tongue up to the roof of the mouth, keep the lips closed, relax that jaw. So that disc, so like even in your hip or your knee, you'll have a disc of cartilage to protect, like a buffer, so that that's sitting in a nice neutral position and it's relaxed. But, people have six-packs here. They're clenching and also going to the gym. People, when they're going to the gym, you're not smiling. So you're clenching. So even there are little mouth jigs that you can get even from Amazon or, even from some of the actual gym companies where you can put that between your teeth to actually separate your teeth. That's not going to have any impact in stopping you grinding or the therapeutic effect of having a splint for clenching, but it is a tooth separator. And I am a big advocate of those.
So if someone did have, really bad TMJ pain, obviously we're going to be encouraging them to go and see their dentist and their doctor. Yeah. But, in the short term, any tips or hints of things that could give them a bit of relief while they're waiting to get that appointment? And any foods that you would avoid eating to try and give that a bit of a rest?
Yeah. So my top tip is just trying to think about the body and being in a neutral position. So I think we're going to find in the future that we're going to have even more problems because of the phone use. So the phone down like this. So trying to keep your head parallel to the ground.
Yeah.
Your head shouldn't be forward. It's putting too much load. So just those simple things of just being aware of posture, just really sitting in a neutral position, and then massaging. Just a heat pack, trying to stretch the jaw, opening and closing, and just sets of those. So I think really treating it like any other part of the body where you would have a muscle strain. Stretching, anti-inflammatories. What works really well is anti-inflammatory topical gel. So, like if you had a sore back, you'd put like a gel on, rubbing that in. And I think just opening and closing, stretching, and then really just resting it. So soft diet, cutting up food. And the big thing, and I think this is really, really important and not many people think about it, is when you yawn. That is a really sort of dangerous activity for a fragile TMJ. And that's obviously an extreme case, but always when you yawn, try to hold your jaw.
Okay, so show me what you mean.
So when you yawn, just doing this. So you're trying to stifle the yawn a little bit. And, menopausal women are yawning a bit more, speaking for myself. But yeah, just trying to minimize the stretch. So I always feel that there is such a disparity between what a patient perceives a pain in the rest of the body as to here. They don't think of this as being a muscle. They don't think of this being bone. They're aware of, oh, I've strained my leg running. Oh, I've strained my arm. I've done too many weights. But we don't think of this area as being similar to those muscles and just really treating them the same.
Yeah, absolutely. So I do find a lot of women hate the mouth guards that they get to help the grinding. They feel, I don't know, self-conscious wearing it in bed. They feel when they wake up in the morning, their mouth feels a bit gross from having, I mean, I do strongly encourage them to wear them, but is there any way around that at all?
Look, I think one that is made very well with the actual guidelines, and funnily, the uni that we went to, one of the profs there in the oral medicine department, he was very, very, very pro splint, and I spent a lot of time in his department, and his prescription for splints is the same as what I use now, and that is actually consensus in splint design. So I think there's a very particular formula that should be used when the splint is being manufactured by the technician or the dentist, whoever's choosing to make it. But it should be, it shouldn't be too thick, should be tolerated, and it should be quite flat so that the patient can actually grind on it without like interferences. But first and foremost, it has to be comfortable.
Yeah. I have a few patients who said that they were just going to buy, those things that like your kids wear to play rugby and things like that. I was like, I don't
Yeah,
think that's a good idea.
no. And sometimes that can actually make them grind more because if you've got something soft in there, it gives the feedback to the brain that you actually clench more. So it's not helpful. Yeah. But they are. Look, it's challenging. When I issue splints, and I pretty much do it every day, I try to look at the patient's eyes as I'm giving it to them to see how, horrified, like how overwhelmed they are feeling and try to gauge that. And then obviously just maintenance and reviewing, checking that it's going okay. And look, surprisingly, people do tend to tolerate. I would say it's probably only maybe 1 in 10 that just can't do it.
Yeah.
And then there are other things that we can do.
Yeah. Okay. Okay. Well, you've all heard it here. You need to put your splint in. Basically, that's the bottom line.
Yeah.
I've had in the last 3 weeks, I've had women who've all got severely cracked teeth. So, I mean, the amount of pressure that you can exert with your jaw is, I would say you wouldn't want to have a finger in there because it would be, obliterated. So you are creating so much pressure. And in one of the patients, actually, her teeth was literally cracked right down into the root, and it was purely from clenching and grinding. So yeah, it is something
I see that a lot. Yeah. And this masseter muscle is the strongest muscle in the body per cubic centimeter. So, this little muscle is actually stronger than, the other muscles that we assume that would be stronger.
So, Martina, I wanted to, I suppose, change pace a little bit and talk about, the facial changes that we see. Lots of people are sort of surprised and shocked to hear that as we age, even the bony structures of the face are changing. Can we talk a little bit about that and from the dental point of view, what is going on?
Yeah. So I always feel like when I'm working as a dentist in the outside of the mouth, that I'm still looking at the mouth inside and thinking about, the anatomy and the teeth. Teeth naturally over time wear and shorten. So that will reduce the length of the face, particularly in that lower third. So if we divide our face up into the upper third, the middle third, the lower third, we find that the lower third will actually shrink in height. Sometimes when someone's grinding, it will be wider because the muscle is getting, bigger. But the bone is changing in the way that its shape is. So I find, and it is a conversation pretty much every day that I have with my female patients saying, oh, my teeth feel like they're like crossing over. They feel like it's becoming narrower. And that's because that bone is remodeling naturally through aging, regardless of male, female. But during this time, I think it's more acute. But this bone here will become a lot more dominant, and this will become a little bit thinner. And then this area here becomes quite hollow. And also then it becomes compounded by the shift in the fat pad becoming a little bit more drooped and thinner. So that the patient just sees that they're not thinking about what's happening with the bone, the teeth, the fat pad, even the muscle. They're just seeing the changes on the skin. It's like the skin is like the drape, like the tablecloth, and everything else is happening underneath just presents like that.
Yeah, absolutely. And so whenever, I have to say, sometimes women will say to me, "Oh, look, I'm gonna have to have some teeth removed, and I've looked at having implants, but it's very expensive." I always say, like, please take a step back and really think if you want to lose those teeth, because it is really going to start to change the shape of your face, because your teeth are holding the whole structure together. And even people who maybe lose teeth on one side, they'll often complain that that nasolabial fold is very prominent, or that they feel like that side of their face looks older. So again, I wonder, could you just explain to the listeners really how crucial dentition is in actually keeping your face shape, and to be honest, probably helping you look younger?
Yeah. So, a nice white tooth with a nice smile is the sign of youth. And I think you really only have bone if you have teeth.
Yeah.
So if we look at like a patient who has lost all of their teeth, their jawbone is so narrow and so thin and so atrophic. It's just there's nothing there, because actually the root of the tooth is what keeps bone.
So
So
it's stimulating the
that's
bone to
right.
stay around.
That's right. And then when we eat, that tooth to tooth contact is actually keeping the jaw bone dense and keeping the jawbone at a good height. So when we lose teeth, so not only from a dental perspective, but it's like driving your car on 3 tires rather than 4. Those 3 other wheels and tires are going to wear out and be full of alignment issues, much, much worse than if they had the 4 cars and the alignment was good. So if we can have a full set of teeth, and what I mean by that is the incisors, obviously at the front, canines are very important. So the eye tooth is really important for taking the load. It's got a really big root. And then the premolars, and of course, ideally having 2 molars, but at least 1 molar. And that will actually keep the height of the bone, which then makes the face attractive and full. And then it gives the fat pad something to hold on to, and the positioning of the fat pad. Because not only, when you talked about the nasolabial fold before, that is also related to how good the mid face, the fat is there, how good the maxilla bone is. So it is all interconnected.
Yeah.
And I think definitely, and also, if you keep your teeth, you're going to have a much better diet. And diet is so critical to aging well.
So if you have like an implant which is implanted into the gum, is that still stimulating the bone to be there? Like a normal tooth would?
So look, they're very different. So a normal tooth is kept in the bone by a ligament, the periodontal ligament, And that is actually a pressure absorber. So every time you bite, the shock goes into the ligament and then you don't crack your tooth. And that's why, when people are grinding, they're actually destroying that ligament, teeth become loose, and that's when you get pain. So an implant is a gold standard way of replacing a tooth, but it doesn't have a ligament. But because there is a prosthesis in there, the bone stays.
Right.
So it 100% is a way of stabilizing the bone and reducing bone loss. And actually, losing bone around an implant is a way that you can actually lose the implant. That's actually one of the contributing factors. So it kind of brings you back to protecting the implant with a splint, eating well, having good hygiene, doing your maintenance. Because a lot of people think, oh, I've got dental implants now. I don't need to see the dentist. I don't have any teeth. But they also need to be really, really well looked after from an oral hygiene point of view, because you can get what's called peri-implantitis, which is peri is around the periphery of something, implant is the tooth, and itis is inflammation. So you can get inflammation around the implant, and that also can be lost. So there's no really way out of not seeing the dentist. You have to just keep going. And I think, look, if you've lost a tooth, it is a really big investment. I understand that. It is a big investment from your time, particularly if you're slightly anxious or nervous about dental procedures, because it's not a quick treatment, and obviously a financial impact. But what I think is really important to say to patients is my role is to future-proof you. So to make you as healthy as you can be now, so that the future you is going to be healthier. So if you've got one tooth that needs to be replaced with an implant, then that's much easier to cope with than having to have all teeth out and have a system where, you're wearing a false denture on 2 or 3 implants.
Yeah. Okay. I've seen a couple of trends that I just would love your opinion on. So I've seen youngish patients who maybe have had really poor dental hygiene and just making the decision that they're going to have all their teeth taken out and just have dentures. Now, I have to say, I clearly am not a dentist, but I'm like, I don't really think that's a very good idea. But have you seen that? I mean, I've seen it in the US a little bit where they kind of go, oh, I can have these like white, pearly white, false teeth, but they're actually these quite young people. What do you think about that?
You're right, it is a trend, and a trend probably driven by social media.
Yeah.
And I guess the desire to have this perfect look. Now, I would say it's probably rare that it's a full extraction and dentures, but it is very, very common for patients to cut their teeth to put veneers on so that they look very, very white, very uniform. But it's a huge biological cost to the tooth. That tooth is changed forever, irreversible. So, and I think, look, yes, getting back to your point of people just don't want to look after their teeth, they don't have hygiene. I think just keep your teeth. They're just so important to your well-being, your sense of self, your self-esteem, your ability to interact with other people. Yeah, I just, obviously I'm a dentist and I'm very pro teeth and as it should be. But yeah, I think we should value them.
Another trend, which I'll be honest, I kind of jumped on a bit, which was Invisalign or braces in older women. And I think that was because I I I didn't need braces when I was younger. But then did feel that my mouth suddenly was becoming crowded. Like I feel like my teeth that were had always sat very straight were starting to overlap. And I was like, what is going on here? Like, why am I, nearly 50 and needing braces? And that's definitely something I think one, it is empowering for women to feel like they've maybe got the money, the ability to go and do something that they've maybe spent a lot of money on their teenagers. And they're kind of like, oh, I've always been self-conscious about my smile. So that's definitely a bit of a trend at the minute. But what do you think are the pros and cons of that?
Look, I think it's a really good thing to do if there is crowding. And getting back to what we were talking about before about this crowding that women complain of most days, usually in the lower ones. So I don't know if go to the dentist and they say, oh, look, you probably need to just clean a little bit more on the inside of those lower front ones, because that's really where you get tartar buildup, because that's where you've got the little ducts of the saliva underneath the tongue, and it comes up and the crystals sit on the back of those teeth, and you're more likely to get periodontal disease. And we know there's a link with periodontal disease and menopause and aging. So I think in the right patient, and if there is a pathology there like crowding, I think it's a great thing to do. And it does mean that future oral hygiene techniques are going to be much, much easier. It's going to be easier to clean. And aesthetically, I think like we should really never underestimate the impact of your perception of yourself when you see something you like and you feel that you look good. It's pretty empowering. Yeah. So I actually think it's a good thing.
Are there any other trends that you've seen recently, either good or bad, that you'd like to mention?
I think there is a huge trend to mistrust health professionals and get your advice on TikTok. Have some patients say, oh, well, I didn't see that on TikTok, or yeah, they don't say that on TikTok. So I've got a huge pushback recently about having dental x-rays done. But dental x-rays are really good screening tools, the way that we would screen for breast cancer, bowel cancer. Screening in dentistry is really important. Pick up small problems, easy to treat. And, OPG, which is the x-ray that goes around the head, actually did pick up 2 cancers last year. So I think screening in dentistry is actually really important. So that's a trend of that little bit of pushback, not wanting to have things done.
So people are saying that they've seen something on TikTok that's basically saying dental x-rays are bad.
Yes, that's right. And I think also you have patients also on social media where, they might see someone and they've filed down their own teeth. You might have seen that one. I mean, it's just making me queasy even to my toes. But yeah, they're getting like files from, say, Bunnings, or ordering them off Amazon, Temu, whatever, and then just filing all of their teeth straight. But it's just going to lead to so much tooth loss and sensitivity. So there was a period of that, definitely, about 2 years ago. People were coming with a lot of sensitivity. They had very straight, flat teeth, and also not really too keen to say, what happened or what they were doing. And then with a bit of probing, the conversation comes out. Yeah. And then the worst one, I think, in my clinic that I've seen is DIY braces. So just, ordering it online and just treating yourself. And I've seen some patients actually lose teeth because of impactions and things. Yeah. So I think like there is this drive of, can we just do it ourselves, like our own whitening, our own filing and shaping of teeth or sculpting. Yeah. So I think just staying away from the DIY.
Yeah. And what about the whitening with the old purple toothpaste trick that you see on TikTok and Instagram? Like people like, I've just brushed my teeth, and then their teeth are like 4 shades wider.
I think in my experience, it's not really going to work. I think like if you do want to whiten your teeth, you just have to watch what your diet is. Don't use anything abrasive, because obviously enamel layer on the tooth is, you can't replenish it once it's gone. And people do tend to overbrush their teeth to try to make them whiter, but actually overbrushing your teeth thins out the enamel. And then the second layer after enamel is dentine, and that's really yellow. And that's what people find then, the teeth become more yellow. So yeah, so not overbrushing. There are lots of good whitening toothpaste, but you need to have peroxide in it. So anything that has like a 6%, you can buy it off the shelf. Long-term use of that, it's safe as long as you're not sensitive. You can alternate with sensitive toothpaste. So use the whitening one in the morning, use the sensitive one at night. And they do work.
Okay. And this may be a controversial question, but what about the places that use a special light to accelerate the whitening?
I think the light is a bit of a gimmick. Right. That's what it might be an accelerator, but there's a lot of heat. There's a lot of heat. And I do think, like, I've actually stopped doing a lot of in-chair whitening with the laser and the lamp and the heat, because there's a lot of sensitivity afterwards. So I think if you've got a committed patient and they have the little trays impressions of the teeth taken, little plastic trays, and they put the gel in there for about a week, 2 weeks. It's a really good long-term result with minimal sensitivity, because that's the big thing when people whiten the teeth. They just become so sensitive and then they don't want to do it. So that's a pretty safe way of doing it. And also you can actually use the tray to put sensitive toothpaste in it and sort of soothe the tooth after you do the whitening.
Yeah.
So I think that's a good way of doing it.
Here are my 3 takeaways from today's conversation with Dr. Martina. Hormones affect your mouth. Falling estrogen changes saliva, gum tissue, and muscle tone, all of which can influence comfort and sleep. Jaw tension and grinding aren't just stress. Hormonal changes can drive clenching, leading to pain and poor sleep. And modern dentistry can support better rest. Tailored dental approaches, from oral devices to airway-focused assessments, can help you sleep and feel better through midlife. You'll find Martina's resources linked in the show notes. If today's conversation resonated, please follow the show and share it with a friend. And remember, this information is general in nature and not intended to replace personalized medical advice. Always speak to your healthcare provider for guidance about your own situation. I'm Dr. Shauna Watts, and I'll see you next time on All About You.